Welcome to Mother's Milk Bank webinar. Today's topic is Be a Hero from Home, How Donor Milk Changes Lives. We have a very special guest speaker here at our webinar, Laura Johnson, who is a lactation consultant who has over, I would say, 10, 15 years of experience as a nurse. Laura, is that right?
Almost 10 years.
Almost 10 years. Amazing. So Laura has a background in lactation. She's been a postpartum nurse, a NICU nurse, and also has worked as a lactation consultant, both inpatient and outpatient. And today we'll be going over our topic related to donor human milk, breast milk, the science and the impact of breast milk. So we'll get started soon. Laura, would you like to say a few words before we go into our topic?
Sure. Hello, everyone. Welcome. Thank you so much for inviting me. It's really an honor to be doing this webinar and to be doing it with you, Fatima, as you're a longtime passionate advocate for breastfeeding and feeding of human milk. And So yeah, just to reiterate my nursing backgrounds in NICU, postpartum lactation, I'm really excited to do this. And I'm also working currently with the Mother's Milk Bank California, where I help screen and approve donors for milk donation. So I have some experience in that domain as well.
Wonderful. Thank you so much for that, Laura. And I have to share that this is really a full circle moment for us. Laura and I actually met about 10, 13 years back, I would say, roughly, when we started. I believe we were getting trained to provide breastfeeding education as volunteers at a hospital in San Francisco.
Right. Well, we were both in nursing school,
Yes,
although not the same. I mean, not the same. We were at the same nursing school, but not in the
a
same
different
class,
program.
right? And we were both doulas, and
Yes.
we volunteered to basically, restart a breastfeeding education program in a women's health clinic that serves underserved populations, and that's how we met. So yeah,
Yeah. And here we are today.
yeah.
So it's wonderful to have you, Laura. And just to give everyone a quick background about me. So again, my name is Fatima. I'm the nurse manager here at Mother's Milk Bank. I oversee the operations for donor services, really covering, from compliance with Hambana, which is our accrediting association, but also working closely with our medical director, Dr. Rachel Land, and our CEO, Jennifer, in creating policies and procedures for donor services, ensuring that our milk remains safe, but also making milk donation accessible for all women, bringing in the awareness around breastfeeding, milk donation, and the impacts that it has. So that's a little bit about me, and we'll jump right into the topics. Just to give everyone actually a quick overview, we'll be going over the science and the impact of pasteurized donor milk. We'll also talk about some of the myths and the barriers around milk donation. And then I will, briefly go over how, the community can get involved, whether it's through, donating milk, supporting the Mother's Milk Bank, and then we'll leave the last like 10 minutes for any questions that anyone has. Please submit your questions and we'll try our best to get through that. All right, so Laura, let's jump right in. I guess my first question for you is, if I may get started, is can you explain to us here what makes donor milk unique as a supplement for infants in the NICU and why it's becoming a preferred choice when a mother's milk isn't available?
Sure. That's a great question. First, before I answer that, though, I think it's important so that we're all on the same page to talk about what is pasteurized donor human milk.
Mm-hmm.
And basically, it's breast milk that's collected from healthy screen donors, which is then heat treated to eliminate any potential harmful bacteria and viruses. So that's what it is. Okay. And we often hear pasteurized donor human milk referred to as medicine for preemie and fragile infants. because we know from the studies that it really significantly improves chances of survival and optimizes their development. So it provides essential nutrients crucial for their growth. It helps develop their immature digestive system. It provides immune support. It contains like antibodies and other immune boosting components that really help them, protect them from infection. And it also reduces health risks associated with prematurity, which I'm going to talk about in a little bit. So babies fed an exclusively human milk diet have really a decreased incidence in severity for four major diseases or infections that commonly affect preemies. Those are NEC or necrotizing enterocolitis, late onset sepsis, chronic lung disease, and retinopathy of prematurity. And I think it's kind of nice to go into that a little bit more detail, if you don't mind,
No,
Fatima,
not at all, please.
because we all know, like I'm sure all our everybody who's here on this webinar knows how important donor milk is, but to actually know like practically like what real difference it makes, I think that's
Mhm.
kind of nice to know and important. Okay.
Yes, let's go into it.
Let's go into it. Okay.
Yeah.
So, but before I do that, I just want to make sure that everyone understands that a mother's own milk will always be the most optimal source of nutrition, okay, for preemie infants. And that pasteurized donor human milk is really, it's recommended when mother's own milk is not available or there's not enough of it, okay? I think that's really important to emphasize that. And working in the NICU, I would, in my experience, I would say that happens a lot actually. So it really fills a big gap. I would estimate that about 30 to 40% maybe. And this is from my own experience. This is not like studies or anything like
Mhm.
that, but I would say about 30 to 40% of moms who have preemie babies in the NICU, or, they may not be preemie, they may be sick, right? Um, don't make enough milk initially, okay, to
Yeah.
meet their baby's needs. And then beyond that, maybe about 10% or so, maybe 15%, in my experience, which is quite a bit, don't aren't able to meet their baby's full needs. They may be able to make some breast milk, but not completely. Okay. And that's due to a lot of things. And I'm not maybe going to go into that right now, but it is a thing that some women, despite pumping, despite doing all the right things, don't make enough milk.
Yeah.
Okay. So donor milk is, we really need to think about it as a bridge and not a crutch. Okay. And so while we're talking about this, and we're all about donor milk here at the Mother's Milk Bank, but I think in parallel, it's also really important to make sure that moms understand that, it's a bridge until they're able to start making their own milk.
Yes.
Okay. And as healthcare professionals, we in the hospital talk about donor human milk, and we really emphasize the importance of feeding donor human milk to babies when mom's milk is not available. But at the same time, we're also encouraging moms, we're helping them, teaching them how to pump and how to hand express, and we're encouraging lots of skin to skin because we
Mhm.
know all of that helps them make them enough milk for their baby. And so I just wanted to emphasize that before we go into
No,
everything.
thank you. And it's really important to note that, the donor human milk is like you said, is available to help fill the gap in that time period where whether the mother is not well, whether she's working on building her supply, there could be a variety of different issues, but it's really to help and support families during that period.
Exactly, exactly. So let's talk about neck, and I'll briefly go over these. I'm not going to go too much, but it's just to give an idea a little bit about what we're dealing here with. So neck, which is necrotizing enterocolitis, is basically it's a really serious gastrointestinal infection that mostly affects premature and low weight babies.
Mhm.
What it is an inflammation of the intestinal tissue, causing it to die. And so sometimes there's even a hole that may form in the baby's intestine, and bacteria can leak into the abdomen or bloodstream through this hole, causing generalized infection. So it's really devastating. And it is the most common cause of mortality and morbidity in the NICU, unfortunately. Some numbers, it affects about 1 in 1,000 preemie babies and 12% of very low birth weight babies, which is less than 1,500 grams, about 3 pounds, will develop neck, and 30% will not survive.
Mm.
And we know from the studies that babies who receive their own mother's milk or donor milk, even if
Mhm.
they receive exclusively donor milk and not very much of their mom's milk, they are less likely to develop neck. And we know also that babies who receive formula are 2 to 4 times more likely to develop neck. So that's a big deal there. Another common condition that we see in the NICU is late onset sepsis, which is an infection that occurs in newborns after the first 72 hours of life, and it typically affects premature babies. And again, NICUs who implement an exclusive human milk diet, so basically they provide donor milk because not all NICUs unfortunately provide donor milk.
Mhm.
It's becoming standard practice, but we're still not there. Okay.
Yeah.
So those NICUs who implement an exclusive human milk diet see a decrease of about 12% in their incidence of late onset sepsis. And both of these, neck and late onset sepsis, have high mortality rates even today. Okay, our third one is chronic lung disease, also called bronchopulmonary dysplasia. And it basically manifests as arrested pulmonary development, which can cause lifelong alterations in heart and lung function. It is also a very common complication after preterm birth. Now, the studies, the effects of pasteurized human donor milk here are a little bit more nuanced, okay, than for neck. Studies show that donor milk does have a protective effect for this condition, in that babies who have this, babies who receive donor human milk and have this, they spend less time on mechanical ventilation compared to babies who receive formula. But it did not affect necessarily the number of days that a baby received supplemental oxygen. Okay. And in this case, a mother's own milk is definitely more protective than receiving only donor human milk.
Okay.
The
Thank
fourth one, did you have any questions,
No,
Fatima?
no, it's great. Thank you.
Yeah. The fourth one is retinopathy of prematurity. And what that is an eye condition that affects premature infants, where basically abnormal blood vessels grow in the retina, potentially leading to vision loss or blindness. Okay. Um, for this condition, studies show that human milk feeding plays a very protective role. It is thought like that the antioxidants in the milk protects the eyes of preterm babies, which often are exposed to a lot of oxygen, right? Because they're premature, and that can affect their eyes. So it's a little bit nuanced, but it's definitely really clear that donor human milk makes a huge difference for these babies, right? So the evidence of exclusive human milk diet, which is defined as either a mom's own milk or pasteurized donor human milk or both, is conclusive. And so, there's really a clear and direct relationship, also between exposure to cow's milk nutrition and an
Mhm.
increase in these four diseases of prematurity. Okay, but neck is really the one that is the most where exclusive donor human milk really makes a huge difference. All the other ones are more nuanced, and there's definitely a better effect with the mom's own milk. Okay. Um, the other thing I wanted to say too is that, not only, I'm going to shift gears here a little bit, but not only does donor human milk save babies' lives, right, and changes outcomes, but it really also affects kind of the long-term outcomes in that it really creates, when you're providing donor human milk in the NICU, it positively affects like a mom's well-being, mental health,
Yeah.
because we're really creating, when doctors and nurses and lactation consultants are putting in the time and effort to, to talk to parents about the importance of feeding human milk to their babies or helping them pump or helping them hand express, or actually putting in, to prepare human, donor human milk is actually, there's an extra step compared to if you were just giving formula, right?
Mhm.
So we're putting in this effort, we're really showing that it's important to us. And that really has a really important effect for parents to see like, oh, wow, this thing is really valuable. Like, I can't tell you how many times, we've had moms who weren't really into like necessarily giving breast milk or
Mhm.
breastfeeding. But when they saw that, they're like, oh, like, okay, this is a thing. This is really important. Like, I'm
Yeah.
going to put in the time and effort to do
Yeah.
this.
No, I agree. It's also, it's um, it impacts the mother and the family, not only, well, the mother specifically emotionally, but I would say even for her health, right? Long term, the benefits of breastfeeding or,
Oh,
yeah.
absolutely. Yes. Yes, that's a whole other thing, that we can maybe go into maybe another
Mhm.
webinar. But yeah, and also actually studies show that parents report reduced anxiety knowing that their infant is receiving safe screen donor human milk. And it just kind of gives them a little bit of leeway, especially for those moms who aren't making that much milk in the beginning, which is unfortunately pretty common. It's like, oh, okay, I have some time here. I'm gonna like work on pumping. I'm gonna do everything, and in the meantime, my baby can receive donor human milk. And they feel really good about that. And I see it all the time in the hospital. They're just so, so grateful,
Yeah. Oh,
So
no, they are. I mean, we see it because it's a lot of the donors that we do get, I would say a good number of them actually come from the NICU. These are families who receive donor milk and now they want to give back. And it's really beautiful to see
that's
that.
beautiful. Yeah.
It really is. And these moms are so committed and so passionate to give back. I
Yeah.
mean, from your experience as a lactation consultant, that, these it's a lot of work to whether
Oh, yeah.
you're breastfeeding directly or you're pumping and storing milk for your baby, but it's a lot of work physically, emotionally. And so to see these moms do this not only for their babies, but for other babies, it's just really remarkable. It
It's
really
really
is.
selfless,
It is.
It's,
It's a
yeah.
selfless act of love and giving to the community and to the people. So it's always really beautiful to witness that and hear those stories.
Yeah. And I also think about all those moms who try so hard and they can't quite make enough milk.
Yeah.
And so being able to receive donor human milk, whether it's just in the hospital or even, going home,
Yeah,
like just helps so much, on so
it
many
really
levels,
does.
helping with
It gives
feelings
them a
of
peace of
guilt and
mind.
sadness, and yeah, so yeah, it makes a big difference. So I think, yeah, that about covers it. I think I said enough
Yeah, no, it's great.
about that topic. Yeah.
So if you can just lightly touch upon the question that I had asked, and then we'll move over to the next,
Um, s-
go into
uh,
the,
do you mean because I think I'm done talking about that.
okay, we can go into, I guess well, you know what, this is actually probably a good segue into going over how donor milk is screened, pasteurized, and safely distributed. And as you mentioned, Laura, donors, so from like a recipient and families we're not, as a milk bank, we're not just providing milk to families that have babies at home or that are recently discharged. We have over 140 hospital partners that we work really closely with, and we provide them milk for whether it's the NICU, their postpartum unit, their well baby unit. So we're distributing milk both for inpatient and outpatient. And outpatient families typically order milk on their own. So, they're reaching out to us, they provide us some information about their baby, what's happening, and then we'll dispense that milk. So, as far as how donor milk is screened, pasteurized, and safely distributed, we have a pretty, I would say, straightforward but rigorous process in place of screening donors, making sure that these are healthy moms who have lifestyles that are not preventing them from becoming donors. And this is to ensure that the milk remains safe, that they are not taking any medications that would potentially prevent them from being able to donate at the time that they're taking the medication. And once they go through that screening process, in a little bit, we'll kind of go into that in more detail. But once they go through that screening process, we receive the milk, and in our lab, the milk goes through pasteurization process. Once, or the milk actually gets batched between 4 to 5 donors. We batch the milk, pasteurize it, and then a sample is sent to the public health department where they do testing to ensure that there's no bacillus, bacteria in the milk. And then from there, once we get the approval or the results for those tests, we're cleared to distribute the milk. And then we start, filling in orders, whether it's from the hospitals or outpatient requests. So that's really just a quick overview of what the process looks like. In a little bit, we'll dive deeper into the screening process and how future donors could, become a donor and what that process looks like for them.
Great. Maybe I think you meant to ask me kind of to talk about in my clinical experience, what changes I saw in
Yes,
infants.
if you can
Is that
highlight
what
just
you
like an
meant? Okay.
example or two, that would be great.
Yeah. So the question is, do I see any changes in infants who receive donor milk compared to those who don't?
Mhm,
And I think it's kind of difficult to say or compare outcomes between babies because
mhm,
there's just, so many factors that influence how a baby develops and their outcomes. That it's kind of hard to just pinpoint it to, oh, that baby received donor milk and that baby didn't. But
mhm,
who we do know from the studies is that babies on an exclusive milk diet often leave the hospital sooner and have an overall lower mortality rate compared to those receiving formula. And after they go home, babies on an exclusive milk diet, so that also includes exclusive donor milk, actually experience fewer doctor's visits or illness and have like a lower hospitalization rate compared to formula-fed
mhm.
infants. Okay, so those are kind of the things that I think are really important to know.
Yeah, no, thank you for sharing that. So we'll go into myths and barriers of milk donation.
Ooh.
We'll get started with what are some of the most common myths you hear about milk donation, Laura?
Yeah,
I'm
there's a
sure there
lot
are a
out
lot
there.
out there. I mean,
There's a lot out
yeah.
there. I kind of picked three to talk about.
Okay.
So maybe the first one I'll talk about that I hear is that donor milk is not nutrient dense. And you do hear that, that people are like, yeah, mom's milk is great, but like, donor milk is just like stripped from everything. It's better to get formula. So
Mhm,
you do hear that, which is not true.
mhm,
But, like first, before we talk about that, I think in general, like it's important to understand that breast milk varies significantly in its nutrient composition from mom to mom, but also from feed to feed in the same mom. So and also, like nutrient composition in breast milk varies depending on stage of lactation. So, like
mhm,
preemie milk is higher in protein, based on genetics, on nutritional differences among mothers, and also baby's needs. So, like when a baby is ill, a mom will produce antibodies specific to that, infection to help ward it off. Okay, so donor milk is like this live food that's like constantly, it's basically so because what donor milk is don is milk pulled from different moms, right? It's not just from
yep,
one mom, and they're all at like these different stages, right? Like that
yes,
we just explained. And though, so donor milk can never be the same, right?
yes,
It's not like formula that's like made in a factory. Like it's not the same thing. You can't even
yeah.
compare, right? So that's important to know, right? But on top of that, like donor human milk is pasteurized, right, for safety.
Mhm,
And that does lead to some loss of like some
mhm,
nutrients and fats, but really overall preserves the milk's nutritional and immune properties. And the one thing I hear often is it has less calories, which that's not true. There's no difference between a mom's own milk that she expressed and donor human milk in terms of like an average overall calories. Okay. And studies, really have shown that pasteurized donor human milk is nutritionally valuable. It meets both term babies and premature babies' nutritional needs. And that it does have, important bioactive components such as antibodies, oligosaccharides, like enzymes that contribute to its superiority over formula. So does that answer, I think?
yeah, no, it's great.
Okay.
Thank you.
Um, a second myth I hear is that donor milk is unsafe, which I know you're going to talk about that a little bit more, so maybe I won't talk too much about that, but or it's gross. I don't know if you've heard
Yeah,
that one.
I've heard of that one,
Ooh,
unfortunately.
like
Yeah.
or even breast milk is gross, but
Yeah.
like donor milk is like this thing is like from this other mom or who
Mhm.
knows what out there,
I
you know?
usually like to look at it as we need to treat milk donation like we treat blood donation.
Exactly, exactly.
Really.
And milk banks really adhere to strict screening as
Oh
pasteurization
yeah, we
processes,
do.
right? To ensure
Yeah.
safety. There's the Habana Human Milk Banking Association of North America, FDA. We're really trying to follow all the standards here, right? And donors undergo really strict and thorough medical screening, right?
Mhm.
Like you said, milk is tested for contaminants. It's pasteurized, which really does a great job of eliminating any potential,
Bacteria. Yeah.
bacteria or viruses.
Mhm.
Okay. So, it's safe. But the other one, the gross part, I was thinking about it. I was like, why do people think milk is gross? Because for me, I don't see it that way at all. So I'm like trying to like empathize and like understand like why do
Yeah.
people, feel that way? And I may be wrong, but I think for me, it has to do that, we really live in a culture that sexualizes breasts. We're much more comfortable sexualizing breasts than actually, looking at, like just being like, yeah, well, breasts are for feeding babies,
Yeah.
Like it can be for both, right? But
Hmm.
like, for some reason, the feeding part because it's so sexualized, I think, perhaps. And many cultures don't have this taboo like ours does.
Yeah.
That's the important thing to know. Breastfeeding in public is normal, it's accepted. That's just how we feed babies, and that's how we've done it since the dawn of time. Formula was not invented before like the mid 1800s, I think. And in a cool kind of fact that not everybody knows actually is, before we had milk banks and pumps and all of that, like women would breastfeed babies that were not biologically their own. It was called
Yeah.
wet nursing. It was a very common practice, and it was considered normal and necessary for the survival of babies when their own moms could not provide breast milk for whatever reason.
Mhm.
So we've always shared milk.
Yeah.
We're just kind of doing it differently right
Yeah.
now.
And
Okay.
we have a process in place to ensure safety and
Yeah.
um so yeah, no, it's you're right about that, and it's unfortunate, but it is a reality, and that's why we have these webinars, is to inform the community and put the information out there that the milk is safe. It's not contaminated or gross, if you
Yeah.
want to call
But
it.
of course I would respect if, a parent was just like, no, it's just like I can't. It could
And if
grow.
it's a
So
cultural
obviously you
or
respect,
religious, yeah,
obviously we respect that, but
yeah,
just, to kind of look into that a little bit more and be like, why is that? It's
mhm,
always good to kind of examine our prejudices, whatever they are, right?
right.
Um, So the third kind of myth I wanted to go over is, and this one like we hear all the time, is formula is the same as breast milk.
Mm.
Formula is not the same as breast milk. And I'll just say it. I think the reason we hear this so much is, there's just a lot of it's an industry,
Yeah,
people make money
unfortunately.
off of selling formula. So it's just the reality we live in. But formula is not the same as breast milk. It's not the same as a mother's own milk. It's not the same at all as donor human milk. Research studies are really clear. You can't really argue with them. And they show that formula feeding leads to increased risk of babies, developing respiratory diseases, gastrointestinal diseases, ear infections. They're more likely to die of SIDS, sudden infant death syndrome. They're also more likely to develop obesity, diabetes later in life, asthma, and allergies. And breast milk is different, because like I said, including donor milk, it's a living food. It contains bioactive substances that protects babies from, common childhood diseases. And formula it doesn't contain that. It's a processed food. It contains all the necessary macronutrients and vitamins for growth, right? But it
Yeah.
lacks those bioactive components of breast milk, like antibodies, which are just very protective and important for growth and immunity and all that. Um, but that said, formula is life-saving, when access to breast milk is not available, but it's just not the optimal way to feed babies. But like that said, we live messy, complicated lives, and it's just not always possible for moms to breastfeed or receive donor milk for a myriad of like very, very valid reasons. So, like when I say this, I always say that because I don't want anybody to feel guilty if they fed formula or they are feeding formula, because it's just a reality. But we're here because we want to make donor human milk and breast milk more accessible to all families. We want families to have choices. Often families give formula either because they're not aware or because they just don't have access. Even if they are aware of the benefits of breastfeeding and breast milk, they don't have access, or they can't, it's it's complex, right? So we're here. We want to make donor human milk accessible to more people, especially NICU babies, especially
Yes.
fragile babies, but really all babies. So hopefully this information was helpful and inspiring for everybody, for
Thank
us
you
to,
so much, Laura.
contribute
Yeah.
to make breast milk more accessible. Yeah.
Yes, and that's our goal here is really to, bring awareness around donor milk, the impact that it has, but also to make the information accessible for all people, and also make the milk available to all babies, regardless of, their socioeconomic backgrounds, their religious background, their race. So it's really, really important that we continue this work, bring the awareness, spread the information. And like I always like to say is like, we need to normalize milk donation. We need to normalize, giving milk, but also, the accessibility of milk, just like we have normalized blood banking, and blood donation.
Yeah. Well, what I guess maybe we can go on and talk about like what reassurances maybe you can give potential donors about the
Yeah,
safety and screening process.
I think this is a really good segue into going over our screening process, and then I can kind of touch upon why we have certain steps in place to provide the reassurance to our community of, mothers, future donors, on what the process looks like and how the reassurance for the families who are receiving milk that the milk is safe, but also for those who are interested in going through the screening process, I can walk them through. So I'm going to actually share my screen here so that I can show you, let's see here. Let me make sure I can do this. Give me 1 second. Oh, unfortunately, it looks like I'm not able. Oh, here it is. Okay. Sorry, Laura, give me 1 second here.
It's okay, take your time.
Are you able to see my screen, Laura, here? The timeline for,
Yes.
yeah, the
Yes,
infographic.
I see
Okay,
it.
perfect. So to go over our screening process, what typically happens if, if a mom, whether in the community, in the hospital, has interest in becoming a donor, typically what happens is the first thing they would do is they would submit an interest form or inquiry form online on our website, and they can go to mothersmilk.org and submit a form of interest, or they can just call us directly. And once they submit that form or they call us, our team of donor coordinators will go through a thorough phone screening where they ask questions about their lifestyle, their medical history, what medications they're taking, and really like go through a lot of medical history questions, but also understanding the reason why the mom is interested in donating, what this, what her lactation journey has been, at the point, when she's contacting us. And during that conversation, if everything goes well, meaning she doesn't really have any diseases that would potentially prevent her from becoming a donor, things like, for instance, hepatitis C, hepatitis B, HTLV, HTLV, syphilis, and there's also medications. I would say a good number of medications are safe for donors to take while they're donating. But we also have a list of medications that are provided to us by Hambana that we are required to apply a deferral. So, you know, a prospective donor could always reach out to us and ask, like, you know, I'm calling because I'm taking this medication. Would it be okay if I can donate while I'm on this medication? And we have a system in place where we can quickly look up the medication and, you know, ask some follow-up questions to understand the big picture. And based on that, we would determine the deferral. So during this phone screening, it's really to get to know this donor, understand their medical history, what's going on. And then at that point, if there's nothing concerning during this phone screening, we'll go ahead and send a donor packet, and that takes, you know, 8 to 10 minutes to fill out. Super easy, yes and no questions related to medical history. Also some questions related to the baby, how they're storing their milk, how they're, you know, how long they like their oldest date of milk. So they'll just go through those questions and answer those questions in the donor packet. Once they submit that to us, we'll work with their primary care provider or their OBGYN to get a clearance form. So now we've done our portion of doing a medical screening, but now we're also asking their doctor to confirm that this potential donor doesn't have any significant medical history, isn't taking on any medications that potentially has a deferral. We also send our donors for labs. So all of our donors have to complete lab work. It's a one-time, you know, lab draw that you get done. We cover the cost of everything while you're donating or going through the screening process. So we'll send you for labs to one of our two lab partners, and we test for, like I said, HTLV, hepatitis B, Hep C, what am I missing? Hep B, Hep C, HTLV, RPR, and
HIV.
HIV. Yeah. So we'll test everyone for this. And then once your medical form comes back from your doctor's office and your lab results come in, we'll send you a cooler. And, you know, we send you instructions. You'll get the cooler, you pack the milk, and, you know, you schedule pickup with FedEx. We'll coordinate all of that for you, and they come pick it up from your doorstep. And so that would be one option. We recently, at the beginning of the summer, this past summer, we started a home pickup service, which has been amazing. We've had such an incredible response from the community and excitement for our home pickup service, where we have a driver going to Alameda County, San Mateo County, and let's see here, Alameda, Santa Clara, and San Francisco to pick up the coolers or the milk from the donor's home. I mean, our calendar's been booked and busy Monday through Friday. It's really, really amazing to see the response from the community. So that's also another option for our local donors, that they can pick up a home, they can schedule a home pickup, but you also have the convenient option of shipping your milk through FedEx, and we receive it. It's sent overnight. We receive it the next day. And the cost associated with your blood work, with shipping your milk, is all covered by us. I will note that we do not compensate our donors, like financially compensate our donors for their donation. This is really out of the goodness of their own heart, their, you know, passion, and their love for wanting to help nourish another baby. Really, that's where the motivation and drive comes from our donors. So let's see here. Yeah, so once we get the cooler, it takes anywhere between 3 to 5 days, I would say, for us to get the milk pasteurized, processed, and then hopefully work with the public health department to get the milk cleared, and then it'll be ready for distribution. Am I missing anything, Laura? Or anything that
No.
you'd like me to highlight?
No, I think you covered it.
Wonderful. So, so that's kind of a little overview of our, you know, our process of becoming a donor. Let's see here. So I just want to make sure we're also on track with time here, Laura.
Yeah, I think we're okay. Yeah, we can just
Wonderful.
keep going. Um, yeah, I think I wish, you know, a lot of people can actually donate milk. I feel like people, think that, oh, I have this disease or this condition, I can't donate milk, I think the
Mm-hmm.
vast majority of people are actually qualified candidates. Obviously they have to go through screening, but
Mm-hmm.
really it's, any mother who has an excess supply of milk and is not taking medications that have deferrals can donate milk. It's really
Yes.
as simple as that. The
Yes.
vast majority of conditions or diseases are okay, and it is safe to donate milk. You already mentioned,
Yes.
obviously if you have HIV, hepatitis B, Hep C,
Mm-hmm.
HIV, syphilis, then no.
Mm-hmm.
But everything else, it's we're really what we can accept is when, people are taking medications really,
Yeah.
to treat that condition,
Yes,
right?
and it's some medications. Like I just want to be clear that it's important that the prospective donor, the future donor, if they're ever interested in donating, it's just so important to have that conversation with our team of donor coordinators to really assess the situation and what medications they're taking or what treatment they're undergoing so that we can better determine if there's a deferral need. But
Yeah,
like you said, overall, most women are capable of donating if they're lactating and they have that supply to be able to donate. And sometimes it could just be stashing that one extra bag of milk a day, right?
right. Yeah,
It
that's
doesn't
another
have to be,
misconception, right? I
yeah,
feel like a lot of people feel like, oh, well, I don't really produce a lot of milk and I can't donate, which is fine if they feel that way, but you don't need to be an overproducer to donate milk. Like,
exactly.
mo any mom who basically can, or I should say, most moms who meet their baby's needs, right?
Hmm.
They very easily can probably make a few extra ounces a day, just by pumping once a day,
Yes.
and stash that slowly. And
Hmm.
and that's how you do it. I think it's actually healthier for the mother's breast to not be an overproducer because that comes with like certain risks, like increased risk of mastitis and plugged ducts, right?
Hmm.
But you just kind of do it slowly. You just like, oh, just one pump a
Yep.
day or this extra little,
Hmm.
uh, that's the best
And
way to.
once you have a nice stash of milk, I like to get started as a donor, we typically require 100 ounces, but I would say our donors range from anywhere from like 3, 4, 500 ounces is like their starting point. And I was just reviewing a donor's file the other day, and this is her second time donating. The first donation that she had with her first baby, she donated 30,000 ounces of milk, Laura. And with her second baby, which is current, she's donating like, I believe it's like close to like 40,000. I was just like,
That's amazing. Wow.
incredible, like really
Okay.
remarkable, like her dedication. And she's just so passionate about being a donor and helping with NICU family. Yeah, it's just really beautiful to see and hear these stories. So yeah, like you said, it's really this actually could be potentially a misconception that you have to be this overproducer or you have to have
Right.
all
You
this
don't.
extra milk. You really don't. Like every ounce that a mother gives really truly makes a difference for that
And
baby.
and I'll just say some moms are fine with being overproducers, but
Mhm.
many moms are not. They're just uncomfortable and,
Yeah.
so it's kind of you have to find that right balance, right? Obviously, the most important is meet your baby's needs. And then if you feel like you have the bandwidth to like put in an extra pump
Yeah.
or whatever, like by all means, And
Yeah.
if you have any questions, definitely call us and
Yes.
ask because we'd be happy to answer any of those questions.
Yeah. And so I want to make sure that we have time for some questions. We're getting
Yeah.
a little closer to the end of this the webinar here, but I want to highlight a couple of points here. One related to our donors, our incredible community of donors. I know there was a question at one point was how do we support and celebrate the generosity of our donors? Like I said, we do not provide any, we don't pay our donors. We're, a nonprofit. It's not, we're not allowed to, compensate any of our donors for their donations. However, we do provide little gifts, thank you gifts, tokens of appreciation to our donors when they send us milk. And this could be something like a t-shirt or a cap, very, very small gifts that our moms are just so happy to receive, these little gifts. But also we've recently started a donor recognition program. And this program, let me see if I can actually share the screen, Laura. Give me a second here. let's try this here. I'm hoping you can see our donor recognition program on our website. Can you see this, Laura?
Yeah.
Okay, wonderful. So this is a program that we recently started. It's our donor recognition circles. So we have these circles where, based on how much you've donated, we celebrate you. You have a community of other moms who are also in this circle, supporting each other. It's a form of like camaraderie, if you would like to call it. And also, we give little tokens of appreciation when you reach these circles. In the near future, we'll provide little pins with these recognition circles. So if you've donated anywhere above like 300 ounces, we'll provide the Milk Warrior circle. So this is a form of recognizing our moms, but also, the true recognition is on the other end of the recipient, the families who are receiving this milk. The amount of gratitude that we get from these families, for the donors that we have is, I think that by itself really truly motivates our donors to continue doing the work that they're doing. And it's such a meaningful journey to be on, to be a donor. And so a lot of our donors are just really doing this out of their own goodness and experience from being on the other side of it as a recipient in the hospital or at home if they had a baby who needed donor milk is really what encourages them to continue donating, becoming a donor, or spreading the word. And, there might be people in the community who are not in the place to donate at the very moment, but there's other ways of getting involved. And, just feel free to go on our website to look at our page, related to, being able to give, whether it's financially, your time, sponsoring a cooler. These are all different ways of being able to give. So I will pause right here, and I think we should allow a few minutes, Laura, to answer some questions. I'm sure there's questions coming in. Let's take a look here. Are you seeing any questions on your side?
Yeah, looks like we have 6 questions.
So I see a question here from Michelle. How long postpartum is a woman eligible to be a donor? If she is over a year or over 2 years postpartum, can she still donate? A woman can donate as long as she wants for that specific baby. So, if she's given birth, she can be 6 months out postpartum, a year, 2 years. It really just depends on her journey of lactating and breastfeeding her baby and how long she's continuing to produce.
Right.
I will actually mark that as answered so that we don't get any mix-ups here. Should breast milk limit their the question related to, do you know what percentage of milk distributed by Mother's Milk Bank is provided to outpatient families, and can outpatient families donate milk, or donor milk needs be covered by insurance? Yes. The last point is regarding insurance. All insurances cover donor milk now. This was a recent change in AB 3051. Part of that change allowed for the coverage of donor milk for recipients, outpatient recipients. So both, Medi-Cal and private, like commercial insurances, cover donor human milk. So that's really exciting. And then we're obviously, our priority is always hospitals. And we currently have over 140 hospital partners, and we're able to provide this milk to them. And we have been consistently, providing milk to all of our outpatient orders. So we're in a place of being able to fill both orders, both outpatient and inpatient. It's really great to see. And I will say that we've only seen an increase in the request, both from the hospital and also outpatient, which is really exciting to see.
That's
But
great.
this also means that we need more donors, right, to keep up with this demand. And the community is responding, and we just want them to continue responding. It takes a village, they say, right?
Right.
I hope that answers the question, Michelle. Let's see here. If we have time for one more question.
How long is the process for an outpatient to be able to receive donor
Oh,
milk?
it takes, I would say just like anywhere between like 2 days, maybe. Like submit the order, we'll try to get the milk out. Yeah, outpatient. So if a family requests milk, they should be able to receive the milk by the next day or a couple of days, I would say.
Great. And is it, I used to hear that if you live within a certain range of the milk bank, they would, or, well, I guess my question is, do you deliver it? Can you pick it up? How does it work?
If you're nearby, you could pick it up. But typically the milk is, shipped overnight, priority overnight. So they receive it
Right.
they're supposed to receive it the next morning.
Um, do we have time for one more question or are we?
We're getting close to well, let's go ahead and try answering one more question. Any other questions here? There's one question that came in earlier. Sorry, we weren't able to get to that. Was, do you know where the majority of donors come from? Great question. Our donors really come from our hospital partners or other hospitals that are, aware of our milk bank being around, and we're actually one of the oldest milk banks. And so there's our hospital partners, community partners. We have our social media is where we get a lot of donors coming through, is through social media. And then just searches online when families are looking to, looking to like what they're looking up, what do they do with their extra milk? And they find us, they land on our page and submit interest. So I would say a good percentage of our donors come from our hospital partners, community, word of mouth, and then also social media and just search engines in general. So, and I would continue to encourage our community partners, hospitals, lactation experts, healthcare experts to talk about milk donation and encourage it and also just normalize it overall. And on our end, I will just add that, we're one of my goals is really one to ensure that our milk remains safe. Of course, that's top priority goal for me, but also to make the process streamlined and accessible to all families. Really, that's one of the two things that I really try to focus on is the safety, but also making the process accessible and easy for all families. So midsummer, I started a Saturday and Sunday screening program, which means that now we have hours both Saturday and Sunday from 9 to 3 p.m. Pacific Standard Time. And this means that the busy working moms or moms who have their hands full with their babies at home on the weekdays when their spouses or families are over on the weekend can have that like 10 minutes to get screened over the phone. They have that opportunity to call us on the weekends and to get screened. And fortunately, we've been booked both Saturday and Sunday. So it's really exciting to see that, people, the response is there. The need is there and people are responding, and it's really wonderful to see.
That's really great to hear.
So let's see here. I think, Laura, do you have any questions on here that I'm trying to see if there's anything else coming in that we could answer in this last couple of minutes before we have to wrap up?
Um, well, one person was just asking, I guess, for herself. She's concerned about her caffeine intake,
Mm-hmm.
asking if she should keep it under 200 milligrams a day for when she feeds her own baby, but she's wondering for preemies if she should take even less.
Do
I
you
don't
have
know what
any input?
thoughts about that, but when a baby receives milk, it's not just from one mom, it's pooled for multiple donors. So, that should dilute anything. But, our guidelines for caffeine, I, as far as I'm aware, we don't have
We don't
any,
have
like,
a deferral for
don't
caffeine.
have a deferral for caffeine.
Yes.
So any amount of caffeine you drink is, we won't defer you for that. But, if you feel comfortable, if you feel better, then by all means, but, that amount should be fine.
Yeah, thank you for answering that. So yeah, we don't have a deferral in place for caffeine. And if you have any other specific questions, feel free to reach out to us via social media or, go on our website, send us an email, send us a message. We're happy to answer any questions. I I want to thank you, Laura, for your time and your knowledge and your expertise. I really appreciate you being here as our guest speaker.
You're welcome, Fatima. It's really been an honor and a pleasure and fun. And we had one last question come in. It says, can we reach out to you to share this information for training? I think this information uh, staff would use when a mom asks when or who they can reach out for donor milk. So
This
where's this video going to be? Is this going to be
It should
shared?
be in our YouTube. And I
Okay,
will
great.
what they would if this individual, if the person who's asking this question, if you can reach out to us via social media or on our website, we're happy to support you in those efforts. So just reach out to us directly, and then we'll be able to support you. Thank you all for your wonderful questions, and I'm sorry we weren't able to get through all the questions. Hopefully, we'll save them for next time, and we'll have our next webinar in about, I will say, I believe it's going to be February of 2026. So I'm excited to have a new speaker for our webinar coming up in February. Thank you all for your time, and thank you, Laura, again.
Thank you.
Have a wonderful
Bye.
day, everyone. Goodbye.